My name is Kasemi Masuda, and today we're going to talk about surgical anatomy of larynx. We're going to start by introduction. The larynx is an apparatus made up of cartilage, ligament, muscles, and mucous membrane, which guards the entrance to the lower respiratory passage, such as trachea, bronchi, and lungs, and houses the vocal cords. External feature of larynx. Larynx is located anterior to the third, fourth, fifth, and sixth cervical vertebra, as you're seeing in the picture. Extends from the base of the tongue to the proximal portion of the trachea. Laryngeal skeleton is suspended from the hyoid bone by the medial and lateral thyroid membrane. The lateral lobes of the thyroid gland lie anterolateral to the thyroid and coracoid cartilage. Isthmus of the thyroid gland lie just below the coracoid cartilage and often covers the first and second tracheal ring. The carotid sheath and its contents lies just posterolateral to the larynx. The recurrent laryngeal nerve ascends in the tracheoesophageal groove and enters the larynx just posterior to the cricothyroid articulation. The third, sixth cervical vertebra, prevertebral muscle, and fascial lie posterior to the larynx. Principal internal feature of the larynx. The cavity of the larynx extends. The border from above is the area of the tip of the epiglottis, aeroepiglottis fold, and the interarytenoid fold, and from the below or inferior to the first tracheal ring. Internal cavity of the larynx divided into three spaces: supraglottic, glottic, and subglottic space. Difference between adult and infant's larynx. We have to remember this 7S. First, size; second, shapes; three, softness; four, superiorly placed in infants; fifth, straighter and less oblique than adults; six, sensitivity is greater in infant, more prone to spasm; seven, subglottis is very narrow. Even a small swelling can lead to airway obstruction in infants. And here we are seeing the average measurement of larynx between the male and female. The length in male is 44, for female 36. Transverse diameter for male 43 and for female 41. Sagittal diameter for male 36 millimeter and for female 26 millimeter. Skeletal anatomy. The larynx consists of cartilage, joint, ligament, membrane, muscles, mucous membrane, and hyoid bone. We are going to start by hyoid bone. It's an U-shaped bone with a body. It has two lesser horn and two greater horn, and it's located in front of the third cervical vertebra. Attachment to the hyoid bone, medial end of the medial constrictor muscle and the sternohyoid ligament attached to lesser corn. The medial constrictor and hypoglossus muscles attached to the greater corn. Gynohyoid and gynoglossus attached to the inner and upper surface of the body, as you're seeing in the picture. The mylohyoid attached to the anterior surface of hyoid, and the muscle of the digastric muscle attached to anterolateral portion of the body. Each muscle acts to depress the hyoid bone. And here we have a surgical consideration. In tracheal resection, an anastomos, a tension-free closure of the distal airway is essential. The larynx can be released and dropped from the hyoid bone to reduce tension on the distal suture line. This is accomplished by detaching the infrahyoid muscles from the inferior surface of the hyoid bone body and cutting the hyoid bone just lateral to the lesser cornea. This releases the central body of the hyoid and larynx. Additional relaxation can be achieved by cutting the suspensory ligament of the superior cornea of the thyroid cartilage. This can lower the larynx to a maximum of 4.5 cm. The hyoid bone serves as a site of access to the supraglottic larynx and pharynx. During the excision of a thyroglossal duct cyst, excision the entire trace along with the central body of the hyoid bone, strength procedure, reduce the recurrency rate. Cartilage of larynx, there are three paired and three unpaired cartilage. Paired are arytenoid, corniculate, cuneiform, and unpaired they are thyroid, cricoid, and epiglottic. We are going to start by thyroid cartilage. It's located anterior to the 4th and 5th cervical vertebra and formed by two lamina, which fuse anteriorly in the midline to the neck, forming a protuberance, the laryngeal prominence, or a Adam's apple. We have to notice that for female, the angle is 120, and for male is 90 degree. The superior limit of fusion of the two lamina forms the superior thyroid notch. Posterior border of each lamina extends upward and downward as a horn-like projection, the superior and inferior cornea. And also they are attached of three muscles, sternothyroid, thyroid, and thyropharyngeus muscles. The thyroid membrane and median thyroid ligament are attached to the upper border of the thyroid cartilage. The lateral thyrohyoid ligament attached to the greater corner of the thyroid cartilage. Five ligaments attached as one on the posterior surface of the thyroid lamina near to the union of lamina or angle. The median thyroepiglottic ligaments, there are two vestibular and two vocal ligaments. In here also we have a surgical consideration. The thyroid cartilage is divided in the midline to expose the endolarynx for various procedures such as partial laryngectomy or laryngotracheoplasty. On the external laryngeal surface in adult male, this point is halfway between the thyroid notch and the inferior border of the thyroid cartilage. It's slightly higher in adult females. In many laryngeofacial approaches, it may be beneficial to stay below the midpoint in order to avoid dividing the anterior commissure. Now we are going to talk about cricoid cartilage, a shape like a signet ring, and the arc is located anteriorly. The cricoid cartilage is situated on vertebral lever C6, and the cricoid lamina has two superior facets and two lower lateral facets. Arising from the arc of the cricoid cartilage anteriorly and externally are the cricothyroid muscles. The lamina has a midline ridge for the tendinous attachment of longitudinal fibers of the esophagus. Lateral to this ridge are the site of origin for the bilateral posterior cricoarytenoid muscles. Surgical consideration: injury to the cricoid cartilage from intubation trauma may result in prechondritis and lead to subglottic stenosis. Surgical approach to repair long-standing subglottic stenosis involve the extension of the circumference of the cricoid ring with autologous cartilage grafts. During an emergency cricothyroidectomy, the thyroidostom tube is inserted through the median cricothyroid ligament, the quickest and easiest access to the airway. To avoid permanent laryngeal stenosis, cricothyroidotomy must be converted to a standard tracheotomy within days. Arytenoid cartilage, they are pyramidal in shape, and they have three surfaces, one base and one apex. And the base has two processes: vocal process and muscular process. Arytenoid has three surfaces: posterior surface, medial surface, anterolateral surface. And the apex of the arytenoid cartilage supports the corniculate cartilage. In here, we also have surgical consideration that cricoarytenoid fixation may occur from arthritis or perichondritis and limit vocal fold mobility. Cricoarytenoid supplication during blind intubation with a lighted stillate. Arytenoectomy through an external and endoscopic approach may alleviate arytenoid fixation or paralysis. Submucosal arytenoectomy, which preserve and intact laryngeal mucosa. Uh, and here we have cornicular cartilage. It's small fibroblastic nodules that site on the apices of the arytenoid cartilage. It has a little functional importance in human. Cuneiform cartilage of Werbe or Vrisberg. It is rod shaped and it's situated in the aretoepiglottic fold anterior to the corniculate cartilage, may be entirely absent. We have three tritate cartilage and occasional minute nodules located in the posterior margin of the thyroid membrane. We are going to talk about epiglottis, long leaf shaped, located behind root of the tongue and the body of the hyoid bone and in front of the laryngeal entrance. It has two ends, upper and lower, two surface, anterior and posterior, two lateral border, upper upper end and lower end, and it attached to the posterior body of the hyoid bone via the hypoglottic ligament. It lies dorsal to the thyroid cartilage and thyroid membrane, guarding the laryngeal entrance. The space between the anterior surface of the epiglottis and the thyroid membrane and thyroid cartilage is called the preglottic space. The epiglottis is attached to the thyroid cartilage by the thyroepiglottic ligaments. The aeroepiglottic folds and the quadrangular membrane attached to the lower part of the lateral margin of the epiglottis. And here we have surgical consideration. Acute epiglottitis may cause airway obstruction in children. To rule out foreign body, a lateral X-ray may be ordered if the general condition of the child permits. Laryngeal visualization must be done in the operating room to avoid airway occlusion or aspiration and cardiac arrest. Intubation and tracheostomy are the procedure of choice. Now we are going to talk about laryngeal ligaments and membrane. There is two membrane, extrinsic, intrinsic, and there are four ligaments: epiglottic ligaments, aryepiglottic fold, vestibular ligament, vocal ligaments. We are going to start by laryngeal membrane. Thyroid membrane provides an extensive connection between the thyroid cartilage and the hyoid bone bilaterally and anteriorly, extending from the upper border and the greater horn of the hyoid bone to the superior horn of the thyroid cartilage and its lamina, and taking posterior margin each side is called the lateral thyrohyoidal ligament. In here, we also have a surgical consideration that the superior laryngeal neurovascular bundle may be injured by surgical approach to the pharynx. One must observe great care when dissecting the greater corn of the hyoid bone and the superior horn of the thyroid cartilage during various pharyngotomy approaches. The Karoko the crocotracheal membrane connect the most superior tracheal cartilage with the inferior border of the coracoid cartilage. And intrinsic membrane, which connect the laryngeal cartilage with each other to regulate movement. There are two intrinsic membrane, conus elasticus and quadrangular membrane. Conus elasticus, it have two parts, medial cricothyroid ligament and lateral cricothyroid membranes. Its free border form the vocal ligaments. Quadrangular membrane extends from the site of the epiglottic cartilage anteriorly to the anterolateral surface of the arytenoid cartilage and posterior inferiorly to the corniculate cartilage, with its covering of mucous membrane form the aeroepiglottic fold superiorly and vestibular ligament inferiorly. It formed the medial wall of the piriform rhizis. Ligament and folds of larynx, as we said, there is four epiglottic ligaments: aeroepiglottic fold, vestibular ligament, and vocal ligament. We have epiglottic ligament and folds. There are hyoepiglottic ligament, pteroepiglottic ligament, median glossoepiglottic ligament, lateral glossoepiglottic or pharyngioepiglottic fold. They are attached between the base of the epiglottic cartilage and the pharyngeal wall to the root of the tongue. The second one is the aeroepiglottic fold, one on each side. They contain the aeroepiglottic muscles associated with the superior border of the quadrangular membrane. Both aeroepiglottic fold constrict the entrance to the larynx and protect the respiratory pathway by not permitting foods, liquids, and foreign bodies. Third, its vestibular fold or false vocal cords, formed by the inferior edge of the quadrangular membrane attached in front to the thyroid cartilage, just below the attachment to the epiglottic cartilage, connected behind to the anterolateral surface of the arytenoid cartilage. The fourth one is vocal ligament, vocal cord, and vocal folds. The tecient ligamentous upper edge of the elastic tissue to the conus or the vocal ligament or vocal cords extend from the medial extremities of the lamina of thyroid cartilage and the median anteriorly to the apex of the vocal process of the arytenoid cartilage on each side posteriorly. Structure of vocal cord, there is histologically 5 layer in here, and we have a surgical consideration. The epithelium of a true vocal cord does not have lymphocytes. Therefore, metastatic disease is a rare phenomenon. The vocal fold are devoid of lymphatics, and it in fact clearly formed the watershed zone between the upper and the lower group of lymphatics. The pathway of metastasis of glottic cancer is via the Delphian node or paratracheal nodes, and finally nodes of the superior mediastinum. Thank you for your attention.